Good afternoon, everyone. Thank you for the opportunity to be in this forum. My name is Walter Kiptrim. I work with Amreveld Africa as a health systems advisor with around 17 years of experience in managing programs. Basically, I work with health system strengthening program, looking at how we can contribute to the strengthened health service delivery in our country. So I'm happy to be here and I look forward to an interactive session, all of us. Thank you.
Thank you very much, Walter. Walter is one of our panelists for today, and he's also been there with us through the other previous webinars. So we appreciate you, sir, and feel most welcome. Next, we have Teresia Mumo. Kindly, Teresia, introduce to us yourself, what you do. After introduction, then we begin our program for afternoon. Welcome, Teresia.
Thank you, Ken. My name is Teresia Mumo. I am a regional manager with Farm Access Foundation. I'm a nurse by profession, and I'm a trainer of trainers in infection prevention for COVID-19. So thank you so much. I want Walter now to take us through the first part of the presentation, then I will follow after he's done. Thank you, Ken.
Thank you very much. Walter, you can take us through the presentation for today.
Yeah, thank you. Teresia has reminded me that I'm still a clinical officer. So I'm happy to be part of this team. Teresia, just a quick introduction is that we've come a long way. Participants, we've come a long way. We started on the 17th of April, where we did introduction to COVID, the background. We came to infection prevention. We did disinfection and even environment cleaning, waste management, surveillance. And last week, we did sample collection on Friday. And out of that, then we are culminating these 6 series of webinars with health workers, safety, rights, and responsibilities. So today we will be able to look at, having been empowered with COVID, then what are our roles and what are our rights, what are our responsibilities, so that we are able to articulate in participating in the fight of COVID-19. So health workers, as we all know and you've all heard, that they are the front line at any outbreak, and COVID is not exception. So all health workers are in the front line in this war against COVID. Therefore, they are in one way or the other exposed to hazards that put them at a higher risk with an outbreak of, for example, COVID, and employers and boards of managers and leaders must then consider looking at ways through which overall responsibility is to ensure necessary prevention and protection are taken into place to minimize occupational safety and risk. What is important here is that we need quality PPEs, we need all the necessary gadgets that we need, including adherence to the prevention strategies of COVID, hand washing, soap, clean water, and all that is sufficient in quantity to where we work, and that in ourselves we are careful enough to really be able to attend to those clients that come to us as health workers. But obviously, please, the health workers should not become infected in the expense because of risks that we could have avoided. Number 2 is when we are addressing IPC and PPEs and all that, one recommendation is that health workers should not be using their own resources to serve in the communities and in the facilities that they work. They need to be supported. That's why we really need a lot of occupational safety for health requirements for the health workers. In the next slide, you will be looking at how then can we approach familiarizing in terms of health workers' rights, including employers and managers. We are saying we need to familiarize ourselves in terms of technical updates of COVID. That's why we are here. And we appreciate you coming to this webinar, because this is one of the ways. We want to say we want to have the necessary tools that are required in the triaging, in the management, and actually handling patients who are suspected or confirmed to have COVID. This will include, therefore, infection prevention information with patients and also the general public so that we do not risk transmitting COVID to other patients in our facilities because of the nature of how we work. And that would mean, therefore, we advise all health workers to do self-assessment. That means if you know you are working in a facility, are you in any way exposed? Are you in higher risk of contracting COVID? Yes. Then is there a case that you feel you have put yourself in a higher risk? In terms of also assessing yourself, that would mean including the temperature check, including symptoms. Are you having any symptom that would point to COVID? If you have any of these or you have any of these concerns, it is important that health workers seek the support of their immediate supervisors so that they are supported to be able to take the necessary action. We are not exempted, we are not immune. Therefore, health workers must continue to consult with other colleagues in the space in their working area to notify management of cases of occupational diseases that would emerge. It's not necessarily COVID alone, anything that could pose a risk, including other infectious diseases. Then health workers are allowed to exercise their right. What is your right? To move yourself from a work situation that may, in your own assessment, become a reasonable justification to believe that it presents an imminent or a serious danger to your own life or health. That one, it is your right. If you make in your own judgment and you feel you are not comfortable, please speak your mind. It is a way of keeping you safe. It is your right. No one will wake up and punish you for no reason. For private facilities, we need to have OSH policies in place so that it is written clearly. Every health institution should be able to link up for health management and support in this area so that they're able to run actually activities. In terms of honoring the rights of compensation, you agree with me that this is a very risky scenario. We need support so that as you sacrifice, you are also compensated commensurately. That would mean if an health worker contracts COVID, the treatment, compensation, to that effect, curative services, if gotten the disease, should be able to be taken care of by the employer you work with, by an arrangement that you need to put in place prior to. This would be considered an occupational exposure, and then therefore you need to be considered as such and be even supported. And that means providing access to mental health. In case of any concerns, fears, psychological worries, you need to be able to access that support and then enable the cooperation between management and your team as health workers and their representatives to be able to discuss how you are working together to mitigate this pandemic together. Next. Then what are we saying? Healthcare workers' responsibilities is one, follow the established occupational safety and health procedures. In COVID, we need to say facilities need to work not as usual, but in a unique way that would consider easy identification of possible suspected COVID clients into your facility. Then change the flow so that those clients who are suspected are seen separately in an independent place. Use the existing and provided protocol, the Ministry of Health website, the KHF website, all these protocols and SOPs. So please visit there, check, download, print, and make it available to your facility teams so that you're able to assess clients, you're able to triage, and even be able to treat. Treatment of patients with respect. This one cannot go without saying. We know that customer care, our clients should be respected. So as much as it's a suspect, it's a COVID scenario, we need to also handle them with compassion and dignity, that they are still human beings. They are not just data. They are not indicators and variables. They are human beings, and human life is worth taking care of. Maintaining confidentiality cannot be overemphasized. You know, as our profession, we are required to maintain this confidentiality. Also, swiftly following established public health reporting procedures for suspected cases. I would wish to say that as a healthcare provider in a private facility, please drop a question or an experience of how you handle suspected cases in your facilities. What is your experience? We would like to know, because many facilities actually do not know the procedure and they tend to really struggle. We are saying linking up to the established rapid response, COVID response team in your counties, in your catchment area, so that you are able to be assisted. That means health workers should provide or reinforce accurate infection prevention control in public health information, including in our facility. If it is IPC protocols, make sure it is well adhered to, including concerns that people who have either symptoms or not, who are at higher risk, should be able to be adhered to, attended to in a separate place. Put on, use and take off and dispose personal protective equipment. Minimally, we are at the national level being advised everyone to be on a mask. Then the rule should be anyone entering your facility must be on a mask. If they don't have, look at provisions of providing one. Even if it is at a cost, it is better than to miss and create a risk state of transmission to yourself and to other clients that you serve. And therefore also want to say, having been able to use, you can also train other health facility teams to be able to know how to use and also remove the same without risking themselves. Self-monitoring, as I mentioned, for signs and illness, self-isolation, report illnesses to your leaders in your department so that you're able to be supported. Otherwise, it will be very unfair for you to continue struggling and you continue also exposing yourself. It's very important that you self-monitor. As I mentioned, advice also on management if they are experiencing signs of undue stress, mental health challenges require support. You can ask management to get that support for you. You also have that responsibility, including reporting to your immediate supervisor of any situation which you may see reasonably justifiable to believe that presents an imminent serious danger to your life and to those you work with. Therefore, we are saying this is determining the risk categorization, who falls where. Not every healthcare worker is at higher risk. Those who are in the front line of isolation places of high suspected cases are the ones at higher risk. Those managing the other patients whom they should be continuing to be seen, then should be able to now arrange so that each of those classified teams of health workers get different, what we call protective equipment, and also because they are exposed differently based on the risk. Protect those who are in paramount importance to the ministry, for example, those who are working in the isolation area, understanding that health workers who are exposed to COVID, how it translates into higher risk, for example, in critical, in informing infection prevention, because they can as well also look at in terms of risking also transmitting the same to their families. So health workers should be able to be careful about this. And in terms of content of the risk assessment, you need information of health worker. Who is this person? Which department they work? Whom they interact with? Are they directly the COVID-19 patients? Yes. So who are these patients? How are they going to be seen? Make sure the information is well taken care of, including health workers' activities that performed in terms of who is doing what. Some would be doing triaging alone, risk assessment for suspected cases. There are those who are doing the triaging and also screening in terms of symptoms and also diagnosis and treatment, lab, nutritionist. So whoever belongs to that team should be able to adhere to the IPC protocol during interaction and also in the facility. With a lot of caution, we avoid accidents. Then in terms of health workers exposure, we are saying we recommend that all health workers with high risk of infection, if you are in any way having a risk and you feel you have been actually categorized to be at a higher risk and you have exposed yourself, you stop all healthcare interaction with the patients and then give yourself, because if this is confirmed, seek support from your immediate supervisor, then seek to have a separate period outside the facility. That is in a self-quarantine for 14 days after the last day of exposure to see whether this confirms COVID or not, and then be tested for COVID within a week, they are saying the best would be after 7 days, so that you are able to see whether you have the, other than the symptoms, whether you are actually having the infection. Then quarantine, as I mentioned, in a designated setting. People used to sing self-quarantine. Now we have designated quarantine sites. There are also facilities who are doing isolation. So health workers need to be provided with a conducive quarantine area where you are able to isolate yourself. And then provide psychological support during this quarantine period, during the illness, for example, and if those who get infected, because we are aware there are those who have gotten COVID, they get to be supported so that they become also strong enough and fight the infection. Finally, you're looking at providing compensation so that those who are, and you are aware, the government and the counties are also looking at ways of compensating. So it's not necessarily in form of salary, but even contract extension, duration of quarantine and illness. That means you are able to even get benefits while you are still receiving treatment. Then refresher infection prevention control training for all health workers in all facilities, including high-risk health workers working in high-risk infection areas, whom they should, even while they are by gotten exposed and they have gone to isolation, when they come back, they need to be also reoriented on the same. That's the recommendation. In summary, then, self-monitoring of temperature and respiratory symptoms. You are looking at reinforcing contacts of droplets, precautions for IPC, including respiratory etiquette, and also the other components of hand washing, sanitizer use. Make sure that you are not seeing one patient and then going to the next without sanitizing, if not hand washing. Reinforce the airborne precaution. That means you don't do procedures that are able to cause aerosol generation or procedures of suspected cases, so avoid that for those ones. Then reinforce the rational, correct, and consistent use of PPEs where you are working with COVID-19 patients. In this case, you apply WHO's my 5 moments of hand washing. Ensure that every client, before and seeing a client, after a client is being attended to, after touching any services that are dealing with such clients, you need to wash and ensure you are always in gloves so that you're able to protect yourself. No use of empty and gloved hands, and practical respiratory etiquette at all times. Those who are handling specialized cases like ventilation need to also be reoriented in that area, because that is important. For example, oxygen. If you're giving respiratory support, you need to also make sure that you are aware of the precautions we need, including making sure that there is oxygen is well humid enough to be utilized. Otherwise, and even the ratio not being too much so that you don't overventilate the client. So those are people working in special places. They need those support, and we recommend that these health workers need to have these skills going forward as you prepare to be part of the winning team in COVID-19. Thank you very much. I have done my part. I want to hand over to Ken. Now you can proceed. Thank you for listening.
Thank you very much, Walter, for that very insightful presentation about how to prepare the health workers to mitigate against COVID-19. So we shall take the second presenter, and thereafter participants will take a round of questions. So now Teresia will take us through risk communication in times of COVID-19. Welcome, Teresia.
Thank you, Ken. And thank you, Walter, for the presentation. Thank you for reminding us that healthcare workers have their rights, but they also have their responsibilities. So they still have their part to play in protecting themselves. So I'll be taking you through risk communication. The objective would be just to know what is risk communication, especially in this time of COVID. What are the barriers that we have in terms of uptake of the advice we're giving to our people, and what interventions do we need to put in place to ensure that we communicate with the people around us. So risk communication is the real-time exchange of information, advice and opinions between experts and the people who face the threat. And I think this is what the national government, especially our CS Mutai Kagwe, has been doing every other day, and the team around him. They are able to communicate the real-time information of what is happening. The purpose is that everyone is able to take informed decision so that we can mitigate the effects of COVID-19 and ensure that we bring this outbreak to a stop. So some of the approaches that are used are different. We use a multidisciplinary approach. We use media communications. We use social media. We use mass awareness campaigns, health promotion, stakeholder engagement, social mobilization, community engagement. So we have a variety of approaches to use. So some of these approaches will be used by the national government, but I think the most important thing is in our healthcare facilities, what are we doing to ensure that we reach out to the people? What messages do we have and how have we positioned that message to the people around us so that they can be able to get the information? And some of the information will come in terms of posters. Posters will be in talking about good hand hygiene, good respiratory hygiene, human exposures, droplet precautions. So we have a lot of posters and a lot of information that has been going around. And just to remind ourselves, when there is an epidemic, there is a whole continuum of where we started and where we are going to end. So at every stage, we should be able to message the information in a good package that the people around or the target audience can be able to understand. In this case, we had a pre-preparedness period before the outbreak got into Kenya. What information are we giving to our people? Then we came to a point where we had an outbreak. The outbreak has already localized around. So we need to be able to message information in the right way. As we go on to the amplification of the outbreak, as we got the point of control and looking at do we prepare for a second wave or what happens. We need to be able to message information in a good way that everybody understands what we need to take or put in place to bring the outbreak to a stop. So what are the key concerns in terms of messages? One of the key concerns would be we could be having cross-infection in hospitals between healthcare providers, between the healthcare providers and the clients, or between the clients and healthcare providers. So that would be one of the key places to be able to start messaging, putting the messages well. We need to see posters talking about infection prevention. We need to see posters and real action in terms of social distancing, in terms of having masks so that we stop the spread of COVID-19. The other concern is that for some outbreaks, like this one that started with animals, there is direct close contact with animals or consumption of raw animals. So that would be for other epidemics that are actually spread from animal. And for this one, we are lucky that we don't have a continued animal transmission. So what are the key messages? So as I said earlier, the key messages are the people who are tasked with this information. And these will be the authorities. We're talking about the government, the spokespersons. We are also the healthcare workers. We are part of the messengers. The hospital management, where majority of us could be working. We have the NGOs who are working in the health space. We have influencers, even in the community health workers, the community champions around there. Travel and tourism sectors, those are key messages, and also animal health officials. And who would be the target audience? Of course, the general public, the healthcare workers, patients, individuals and families, travelers and population, and other vulnerable groups. For example, the migrant workers, people in camps. So some of the messages, just to bring us to speed with what has been done, government has really tried to put messages across. So like this one, just an example that concern would be, how can I avoid contracting the virus? So one of the key messages is frequently clean your hands using alcohol-based hand rub or soap and water. So I think the government has really done a lot in terms of messaging or putting the messages across in the best way. But in our healthcare facilities, are we having this information continuously to our people? Either through posters, there are some people who are a bit high-tech, have maybe TVs around. Do we have anything showing around? Do we have any health? This that have the proper message. So remember that even in the healthcare facilities, we are part of the key influential people. We should be able to talk to our people. If you're working in a place where maybe it's not Nairobi, it's not metropolitan, maybe in the up country, we need to have messages that are in the local languages, in the Kikuyu, in the Luo, in the local languages, so that my grandmother can be able to even read or understand, or listen and understand what is being said. Okay, so one of the key posters I would want to see is a poster on hand washing in every facility. Hand washing for at least 20 seconds before touching any patient, before a septic procedure, after body fluid exposure, before touching patients, before and after wearing any personal protective equipment, and performing hand hygiene. And I would want to see health facilities supervise each other, where staff can supervise the rest of the staff in terms of how are you doing the hand washing, how are you wearing your PPE, how are you removing, because I think we are in a different era that calls for us to behave differently. So other messages will be on respiratory etiquette, and these ones have been common, but I want to see a poster, at least in healthcare facilities, talking about covering your cough and wearing your mask, ensure that facilities even direct clients on where to dispose their masks, and also even where to dispose their used tissues. Remember, we are saying that people should cough tissue and dispose it in the right bin. Then we also need to have a poster talking about droplet precaution, e.g. wearing a mask and even the social distancing. Why are we telling people to social distance? We need to be able to bring out that message clearly to people. Others will be, I think this one we've already talked about, hand washing and covering your mouth with tissue. We also have key messages on, say, your doctor or healthcare worker, if you develop a fever, cough within 14 days after returning from an outbreak area, and provide your travel history. So this is information that needs also to appear in our healthcare facilities. And even as healthcare providers, in our work settings, are we having such messages among healthcare workers? Do they know the policy? Walter has just talked about the occupational health and safety policy. Do they know that they need to report to their supervisors? What action has been put in place? What measures have been put in place, maybe to cover their shifts if they're going to self-isolate for 14 days? So let's talk about some of the barriers to taking up of this health advice. I think we have seen a bit of defiance in terms of taking up the health advice in maybe I can mention in Isli, in Mombasa, also Old Town. But what would be the barriers? What is making people not take up the messaging? So part of it could be the cultural and traditional practices. I think it is clear that people have their own traditions in terms of sharing, maybe their work, their homes. I heard the other day that in Mombasa Old Town, people share kitchens, even in different families can share one kitchen. Even in the estate in Nairobi and the urban areas, some estates, people share washrooms. So we could have traditional and the cultural practices. So some healthcare practices are taking care of sick members. Remember that we are people who take care of each other. So as much as you're telling me to put a mask and I'm taking care of my sick grandmother, how does that come in? Yet we are saying the healthcare, the old people should be protected. So those are some of the barriers that we have. We also have a barrier in terms of healthcare seeking behavior. I heard the other day that somebody was saying they haven't seen corona. So what are you talking about? So we need to understand the health seeking behavior of the people around us. You could be working in a facility in the country, somewhere deep in maybe Meru County. How is the health seeking behavior of the men around there? So we need to understand the barrier so that you can message well and package your message well. Then the other barrier could be close family contact, close living quarters, where we have a small room where with maybe 5 or 6 family members. How do you message? How do you tell these people to keep a distance? Then one of the other barriers would be maybe for epidemics that are brought about by eating foods that are not well cooked. So some foods, traditional foods, maybe are not cooked well, And we know of our own cultural practices in some tribes, maybe who eat maybe raw meat or take whole blood that has not been boiled. So those are messages that need to be put out well in such epidemics. The other barrier is trust or lack of trust in authorities. Do we trust the authorities that has given us this information or this advice? Do we trust our government? Because I think that is the supreme body that is talking to us now, followed by healthcare professionals. So is the information coming from those sources reliable or credible? Do you trust in the messenger? Do we have a CS whom we trust? And are the messages and guidance to the public consistent across several channels? So what does the Ministry of Health have consistent information across all the channels? So that is one of the key things that need to be looked into so that we overcome the barrier and people will be able to have the information. So for us to be able to gain trust so that people take up the health advice, we need to be open and honest and transparent in our healthcare facility. If you have a COVID-19 case, you need to be open and honest and transparent and tell your staff and tell your and warn anyone around. Maybe you have an isolation room, you have the suspect case. So that needs to be open and transparent so that we don't have rumors moving around. Then you need to be consistent. I think the government has done well in being consistent in that every day we have an update of the status. Then you need to communicate fast and frequently. If you have this information that you have this and these cases in your healthcare facilities, you need to be the first person to be able to come out and talk so that we don't have rumors. Because once we start having rumors, then people don't trust the system. So you need to state what you know, what you don't know, and what you are doing about it. So if in your healthcare facilities, maybe you're, God forbid that maybe a client passes on, what do you say? So you need to come out and say what you know, what you don't know, and what you're going to do about the situation. Then you also need to show empathy because it's a serious situation. It touches on lives. We need to be able to show empathy to people. Then address any concerns and to do follow-up on what you have told people that you'll be able to maybe to follow up so that people can gain trust in you. So the other barrier is a lack of knowledge on how the disease is transmitted. So we need to tell people about the human-to-human transmission, maybe the travel and transportation, the hospitals and healthcare settings, which can also be a conduit for transmission. We need to talk to people about mass gatherings so that people are able to definitely understand why they are maybe restricted in terms of movement in this partial lockdown. So once people get the knowledge, then they can be able to understand and pick up the message. The other barrier is some population groups may not have access to appropriate information. So that one is linked to the other one that talked about lack of knowledge. So some groups may not have the appropriate information. Do you have people in our communities who talk sign language, or do that community, are they waiting until they see the news in the TV where there's somebody who talks in sign language? What if they don't have a TV? Who is reaching out to that community so that they have the proper information? Okay, so that's one of the barriers. So we need to be the first and be fast again and be frequent with the information that we give to our people. That cascades down to the facilities. Even as if there's a facility owner, they need to be at the forefront in talking about the COVID status in the facility and what they are doing and what they don't do, so that everybody is on the same page. So we need to be proactive in disseminating information with frequent updates. We need to use a mix of tactics and approaches in risk communication, and I know in the next slide we'll be able to talk about the approaches that we can have. Then we also need to identify and manage rumors and misinformation quickly, because this is what can now make people not trust the system. And then we need to develop easy and understand materials in languages and preferred channels of affected population. I know we have seen several materials or posters in local languages. I think that is what needs to be in almost every other facility. You map up your population, and then besides having the English and the Swahili posters, ensure that you also have materials in the local language. So some of the information can be media communication, public statements and announcements. We can have two-way communications with affected populations, such as in hotlines, radio calling shows, and these will be the local radios in the community. Then mass awareness initiatives, including suitable IEC materials, information materials. Then social mobilization through the community of workers, indirect engagement with at-risk communities. And then some of the other best practice would be engagement with partners and communities. So in the healthcare facilities, remember that this also narrows down to where you're working. What mode of communication are you having? Do you have the social media pages? What communication, what messages are you running through your social media pages at this time? So to operationalize this, we need to have this communication be part of the health operations of the incident management system. Remember, at the beginning of this webinar, we see that all facilities should have COVID-19 response team. So one of the persons there should be tasked with the risk communication to be able to communicate to everyone about a case that happened, about the status of the facility in terms of handling this COVID-19 and whatever information that comes up. And we have said that that person should be the first and give frequent information to the rest of the team. Then we need to be able to develop a risk communication plan with concise objectives. This can be as much as the person will have meetings with the team, but how often do you update your social pages? How often do you review your posters? How often do you log into the WHO and other credible sources of information and download material? Remember that we have a lot of information circulating around, and your team can get information overload. So you need to identify a credible source of information, either the WHO, Ministry of Health, and the CDC. And this person has with risk communication to be able to update the team so that we don't have people forwarding messages from all over. You need to be able to centralize that information to one person. And of course, you need to find the resources and the people to be able to do that. And the one is that the person should be able to manage any rumors and fast track release of any information that they have. Okay. And then we establish a mechanism for monitoring media, the social media, the rumors, and provide timely information and be able to disregard those rumors in the best way possible. So which are the best practices? So just to sum up, we need to create and maintain trust, even in our facilities. Let's share. If we have a patient who turned positive, or we are isolating, or we are already at treatment center, we need to be able to remain that and create trust in the system and put in measures to be able to protect everyone. We also need to acknowledge and communicate, even in uncertainty. Even when you don't know what to do, we need to say that you don't know, but there's something that we are doing about it. Ensure that we coordinate communication well in the facility. If a patient was handled by staff and the test came out the following day and the patient was turned positive, how do you coordinate the communication to the staff? Who talks to the staff, or do they get rumors from the person at the lab? So that information needs to be channeled in the right way. You need to be transparent. First, one I have said over and over. You need to be proactive in public communication. So you need to be able to come out and talk to your patients. Maybe you have an inpatient, maybe of 100 patients in the ward. So what messaging are you communicating to them? Are you talking to them about how you protect them? Okay, and how they can also protect themselves. You also need to involve and engage those affected. This could be your staff. Maybe some of them are in self-quarantine because they were exposed. So how are you involving them? How are you checking up with them so that they can even trust the system again? And then use the integrated approaches that we've talked about, and then we build on national capacity and support the ownership of the strategies that are being put in place. So this, just to sum up again, some of the tactics to use: public communication, media communication, social media, mass awareness, health promotion through community of workers, engagement, and community engagement. So risk communications is wide, and it calls for good utilization of the approaches that are there so that we can help our people understand the outbreak that we are facing and to be able to mitigate the effects of this COVID-19. So thank you so much. Over to you, Ken.
Thank you very much, Teresia, for that elaborate presentation on communication. Now, let me take one question, and then Walter will then come in. The question of miscommunication and discommunication. We have that many people share information on WhatsApps and social media, and most of it people say it is they are myths or they are just theories. How would we relate to information that is being shared on social media and we have no clarity with the origin?
I think that's why we are emphasizing that the facility needs to streamline communication within the facility. I know most facilities now have WhatsApp groups, maybe for different teams or for the whole team, depending on how big or small the facility is. So the person tasked with communication should be able to verify all the information that goes on to staff, and also warn staff of forwarding information they have no clarity on. So information is there, and sometimes you may not even have control over who sends you what, but the person tasked with communicating should be able to streamline work WhatsApp groups so that whatever is there is credible information, either from Ministry of Health, from CDC or World Health Organization, or a partner in the facility that will give credible information. And what we have said is that the person should be able to be constantly updated with any information on COVID-19 that they can be able to share with the facilities. Yes. Yes, Ken?
Yes, thank you very much, Teresia. And also, when it comes to communication, we find that many people believe that Corona is being only fought from the public health facilities. Do we have some communication that shows that the private health sector is also involved? Because there's a question being raised that some in the private sector have never been trained, have never been communicated about Corona activities. How can we clarify this concept?
I think we are exposed even as private healthcare workers when we are not even trained by the government, and the cases we know, but for the facilities will receive the patients, they will even treat them unknowingly, and the patients may go even for the mass screenings and they be identified there. I think it's a gap there in terms of training, and that is why we are coming in just to step on the gap. And it's not true that COVID-19 is being addressed by the government facilities. I think, God forbid, we are not even at a peak. And we pray that we don't get that far. But if the case goes by the way we've seen other countries, that we need as private healthcare facilities to prepare ourselves. And I think that's why we're having webinars to try and reach out to you, to ask you how prepared are you in the facility? Are you screening? If you get a suspect client, do you have an isolation room? Do you have an isolation ward? Are you able to keep a patient locked there before you transfer them to the other government center? So I think even as time goes and as the government watches on how the wave goes, they might start opening up now to private facilities and see who can isolate, who can treat, and even give to them the treatment or the case management protocols. Maybe Walter has something to say.
Yes, Walter?
Yes, yeah. Thank you, Teresia. Thank you, Ken. For me, it is particularly saying everybody is in this together. We cannot segregate. And having not been trained is not an excuse. We will see clients, they come like any other. The best thing is to prepare. That's why we are here. That's why we are offering these webinars, because we feel we want to contribute to reach to you who has not been reached. If we get even more, if you people are willing, we will even continue to carry out these webinars to enlighten and also strengthen our capacity to handle the cases as we go along. As Teresia said, that as a country, we are now seeing our curve going up. We expected that if you look at as it is, many people will have been seen by private facilities, but how many people have been seen unknowingly because we are not prepared? The question is, we need to prepare, and we need to have a team in every facility that are going to respond to COVID, from establishing the processes, rearranging the flow of patients, even making sure that we have the gadgets that are working and that every situation is taken care of, so that you stay and work as if you have COVID today, than wait until many pass your hands without knowing and continue to expose yourselves as health workers and also your families. If you look at the way they're saying case number this, got exposed to this, that we are not immune as health workers, we are also at a higher risk. So we need to prepare now.
Yes, Walter, on the same point, there is a video doing rounds today on social media of a mother who is a good Samaritan. She picked some two casualties by the roadside and take them to a facility on Thika Road. Upon arrival, the nurses and the other staff there saw the people at the booth and they ran away. So is it lack of communication, or is it misinformation, or how is it that when they see casualties being brought in, instead of looking at what has brought them there, they take to their heels?
Ken, I have not seen the videos you are saying, but if that is the case, it means we are not prepared. It means we are not willing to be the frontline soldiers as we are. Our profession calls for information to be synthesized very fast and prepare. So all facilities and all health workers need to prepare. Anyone can be called upon to assist in an emergency like this. So taking off is not a solution. Remember, you carry the image of the facility you work in. You are not on your own. You carry the image of your profession. You carry the image of the people that really, really rely on you. So they want to see you assisting them. So we need to be prepared early enough. For example, when a client enters, what happens, who does the triage, who classifies that this is a normal case or is a surgical case or a COVID-19 case, and therefore suspected, therefore sent to the necessary place. So organize. If you have one or two consultation places, still organize yourself. You can be able to do. I've seen facilities where they even establish tents near the gates where the clients come and then they get to be checked on vital signs, temperatures, and ask a few questions. If they have anything like eye fever and they have cough and all that, they are seen in a place separately, yes, but to be able to be assessed, is it COVID or just pneumonia? The question that we need all of us to be prepared to be able to handle the clients, at the same time, be able to work swiftly to save lives, reduce infection, transmission, and exposure, at the same time, being precise in diagnosis so that we don't miss and mismanage a client.
And just to add, Ken,
Yes.
I think running away from a client is cowardice, and it beats the logic as to why we are healthcare workers. And while you are running away from a client who is very sick, we are told that majority of the clients, maybe even more than 80%, have no symptoms. So the client, you could be clerking in your consultation room with maybe just a cough, or you're thinking it's maybe asthma, that's a COVID-19 case. So I think we just need to have the right PPE and the right information to be able to handle clients. If a client comes through your door, it's not a must that you admit them. If you have no admission ward, but do you have a referral protocol? What do you put in place? Remember that giving emergency service to clients is in our constitution, and it is a right for our clients to receive emergency care. Thank you, Ken.
Ken,
Ken. There's a quick one. I had a conversation with a private facility just this week, and I asked them, how do you handle COVID-19 suspected cases?
Yes.
In terms of protocol, the requirement is, having had a suspected case, you communicate with the COVID response team in your area. However, it is the role of the facility to isolate a client, collect a lab sample, and make sure the sample reaches the reference lab for confirmation. It is upon receiving confirmed COVID results that the client is taken to quarantine, to isolation facilities. So as private sector, we need to be prepared to do exactly that. Meaning, one, identify, collect sample, isolate the client, and then wait for the results. You can see it takes up to how many days? 24 hours plus. So what that means is we need to be prepared, because you cannot chase away a client whom you suspect. You have to give them in the facility through an admission, so you need to have a space for those clients if you are having a ward. Thank you very much.
Thank you very much, Walter and Teresia. And also to add on the same is that we as frontline workers, it's upon us to be able to, as you mentioned, prepare our facilities. Our our hospital administration and medical directors of each and every facility has to sit down with his team and identify which areas they can be able to support, even in a smaller fraction, so that when such cases where clients present themselves and everybody disappear doesn't occur. If such cases happen, then it means the executive, the decision makers of that facility have never sat and talked about COVID-19. If they ever did, then at least they'll identify 1 or 2 or 3 or 4 persons who will be able to take into consideration. Somebody comes, what do they do? Because the ministry normally on a daily basis inform the public, inform everyone that this is the procedures to be taken in case of a COVID-19 case presentation. There are phone numbers given to be called. So I believe that even us as frontliners, even if you're not in a position to take care accurately or efficiently the persons with COVID-19, then we have the phone. We can call for the ambulance to come for them and take them to the correct places instead of leaving them there they called, because a life lost will never be recovered again. So in the interest of time, we were given 1 hour, and we started 10 minutes past the time, and currently we are 10 minutes past the hour. So I'll request that we give a round of last parting shot, so that we can be able to close the session in readiness for tomorrow. So we'll start with Teresia, then Walter, then we close up.
Thank you, Ken. I think I just want to remind our healthcare providers in this forum that we are on the front line, and we should prepare ourselves. Let's have the necessary PPE, let's have the right information, and let's treat our patients with dignity and with compassion. Remember that we cannot be the first ones to start stigmatizing our clients. We need to be able to restore dignity, treat them in the best way. If you cannot, then you should be able to refer them in the best way possible to the next treatment center. And in terms of communication, let's ensure that we have somebody in the facility who handles all communication matters regarding to COVID-19 and even regarding to occupational health and safety, so that we don't have a lot of information that some is not verified from some weird sources, but we have the right information for the facility and for the community around us. Thank you, Ken, and thank you, attendees, for being with us today.
Thank you, Teresia. Walter, your parting shot?
Yes, thank you, Ken. I really appreciate everyone. It's been a long journey of 6 series of webinars. And today we've come to a close in terms of the number of webinars we've concluded for the COVID. However, going forward, we have a series of also themes, topics coming up, and we'll be able to share together. And please keep it here. We will be informing you of the next front, and we'll be able to support you to be prepared to handle COVID-19 clients in your facilities, and you'll be empowered to be able to rise to the occasion. So wish you everyone the best, and let's look forward to an interactive session in the coming week.
Thank you very much, Walter, for the closing remark. To our participants, we want to appreciate, and also I want to reiterate this fact that you can feel free to write to COVID-19 at khf.co.ke and request for any topic that you want to be covered. Also, we are here online every Tuesday, Thursday, and Friday. So feel very much welcomed, and we appreciate your timing as well. We've taken into consideration that a majority of us want these sessions later in the evening because during these hours, we're supposed to be a majority are on duty. So we thank you and we appreciate you. So let's remember, let's not forward any information that we get. Let's seek for clarity and let's sanitize. Let's stay healthy, keep our children safe, and God bless you till we meet again tomorrow afternoon. Bye-bye.